Welcome back, everybody. Okay, so it is fall, right? 40 million of people in America right now are dealing with fall allergies. So we've got a lot of questions.
I'm
and we're
one of
gonna
them.
get a lot of answers.
I have so many questions.
Are you sneezy?
All the time, sneezy, like my nose is stuffy, my eyes are watering. It is fall. What's going on?
It's a lot of problems. We got Dr. Nadim Bikhazi here from the Ogden Clinic. He's an ear, nose, and throat doctor, so he's got all of the answers for us. First of all, who are the culprits behind these fall allergies that we're dealing with?
You know, as the weather changes and is more beautiful, the main allergens are ragweed, sagebrush, and mold. So as the weather gets a little bit cooler, the leaves change and it looks pretty to everyone but allergy sufferers. And those people that suffer from itchy eyes, runny nose, nasal congestion. And it's a really big problem.
So
it's just disgusting.
I always think I have a cold. How do I know if it's not a cold and it's actually an allergic reaction?
It's a great question, very common. Patients always ask that. Really severity, colds tend to present with severe sore throat, severe fever right away. Allergies tend to be a little bit more insidious, slower developing symptoms. Although on bad days, dry, windy days, people with nasal congestion can really flare. But in general, the severity, the fever, the sore throat would be one of the main differences.
So can you suddenly just start developing allergies? Like I'm 33 years old and I haven't had allergy problems and all of a sudden I've got allergies.
Michelle, we get that question commonly from patients, especially if you have a family history of allergies. People can develop allergies later in life into adulthood. And usually changes of environment, maybe changes in the workplace, or you move to a new city, they expose you to different allergens, and now all of a sudden the allergies come out that weren't there before.
So Cody is getting allergies from Utah.
That's right.
As we speak, he's now exposed, and that can happen.
Yeah, and
right?
it's not Michelle, it's the environment. Yeah.
Let's hope not.
Yeah, but that happens, and those people that present later on, they go, what are these symptoms? These are new to me. But, you know, congestion and drainage can lead right into the winter and become sinus infections. So we really want to get those under control.
To me, I get sinus infections a couple times a year. So what should we be doing now so we can stop it before it does become a bigger problem?
What you said, Emily, is the key is prevention. You want to jump on the symptoms early. You don't want to wait till you get them because then you're behind the eight ball. Prevention really is antihistamines and nasal steroids or nasal antihistamines. Those are prescription strength.
Talk about the sprays, because that's what my doctor has done, because it gets so dry up there, it gets so painful, and that just seems to make the problem even worse.
Yeah, so sprays are difficult for some people to use, but they're meant to calm down the inflammation in the nose. And they're meant to be used on a chronic basis. You can't wait till the last minute to use them.
Right.
And that's the problem. A lot of people reach for the over-the-counter medications in their pharmacy. Those are very short-term. So really prevention, get on top of it early. If you're behind the eight ball, you can certainly go get some of the over-the-counter preparations, but patients need to know two main risks. Benadryl in a lot of those preparations can make you sedated and can affect driving and work performance. And Sudafed in a lot of those can affect people with high blood pressure. So you want to be careful in those categories.
If it says non-drowsy, does it really mean non-drowsy?
It does. It means, though, that you have more Sudafed, and again, if you have high blood pressure, you want to be really aware of that. Also, you can have a rebound effect from those medications. They feel really good for a few hours, and then bang, 3-4 hours later, you're even worse than you were before.
Now, what about the medications that they tell you can only take for 2 days? Those sprays.
We
Afrin,
deal with that a lot.
So I love Afrin, but you have to be so careful because after a couple
You can
of days,
get addicted to that stuff, right?
Yeah, it causes big
we
issues.
get people addicted to it where they can't get off of it, and it's that rebound swelling. So you don't want to be using them more than 2 days. It's okay in an acute cold or allergy situation to use them, but you don't want to be using it a lot longer. If you are addicted to them, we have to work progressively to get you off of that nasal spray.
At what point do you need to skip the over-the-counter medication and just see a doctor?
Yeah, so if the symptoms have been recurrent every year or severe, where you're just saying these are out of control, that's the time to see a physician. They can get you more intensive prescription strength medication and also test you for allergies, because knowledge is powerful. If you know you're sensitive to ragweed, ragweed is a tremendous allergen. One plant produces over 1 billion spores, and they can travel hundreds of miles.
It's nasty.
So the whole United States is blanketed with ragweed pollen. So people who suffer from it can also have cross-reactivity to fruits, such as bananas. And when they eat cantaloupe, they can get itching around their mouth, all from a cross-reactivity to ragweed allergens.
Can I make an appointment with you?
You're
Can we
welcome
talk
to.
after this?
Well,
Yeah,
he
for
makes
sure.
people happy. I'm sure they come into you, and so many of us are just miserable.
Well, it can be debilitating. It's
Yeah,
really...
so one thing that we don't do is minimize allergy symptoms. People who suffer, they can lead into chronic headaches and chronic sinus problems, and even into depression. If you have these symptoms all the time, it can really knock you down. So I think that's the time you want
and then
to
it causes
go to a physician.
migraines. That's what it does for me, is that it triggers my headaches, and then I am no fun to be around.
Well, it's nice to have someone that you know knows the answers and that you can talk to if you are suffering from allergies. The Ogden Clinic, all of their information on your screen. They're on Harrison Boulevard. You can also go to ogdenclinic.com or our website, and we will link you. But yeah, ear, nose, throat, all those things that are bothering you right now, you can help. Thank you, doctor.
Thank you so much.
for being here.
Yes, you guys, we are up next in the kitchen making cupcakes, Halloween stuff, embellishing,
Eating.
decorating.
Waiting for you, Gina.
I might bring Cody back in.
Yes,
Stay
perfect.
tuned.
And socks and sandals are in. That's right. Is it chic, confusing, or simply scandalous? Coming up later, hot fall fashion secrets on Good Things Utah.